Today we will speak about routine EEG examinations, and first of all I'd like to ask Tatyana, our doctor who is responsible for EEG area, briefly describe us EEG technique and intended of use of this technician. Please, Tatyana.
Good day, I'm glad to see you. Our webinar is dedicated to electroencephalography, and electroencephalography is a recording of the electrical activity of the brain that help us to evaluate the functional activity of the brain. And Hasberger was the first who recorded the human EEG in 1924. And now, almost 100 years later, this method remains a very useful technique in medicine. EEG has been adopted for several indications, and now electroencephalography is indicated for diagnosis of the seizures, epilepsy, and management of patients with epilepsy. We use this method to identify the candidates for the epilepsy surgery. We use this method for the diagnosis of the paroxysmal events in patients, and electroencephalography is a very important method for critical ill patient at high risk of brain damage in the intensive care unit. They use this method in diagnostic of the nature of paroxysmal events, and so it's related to evaluation of patients with psychiatric symptoms and others. This method can be used in such specific cases for examination of a patient with attention deficit and hyperactivity disorders, or for autism, for example. And yes, now we start with the routine EEG test, which is a very wide used test, and it's a very traditional method in EEG. It's an inexpensive method, it's easy method, it's not invasive method. That's very important. And of course, the quality of EEG recording depends on the quality of the electrodes, and I think that can be used different types of electrodes. It could be the bridge electrode, cap electrode, or cap systems. And I think that now the Alexey is ready to show you the different types of electrodes which we can offer our users.
Yes, thank you, Tatyana. And first of all, let's look at the accessories which we are using for routine EEG examinations. First of all, it is EEG electrodes. We have several types of such electrodes. For example, it can be invasive and non-invasive EEG electrodes. Here is non-invasive EEG electrodes. For example, this is a bridge EEG electrode. It's looking like this. We can use these electrodes with such helmets. We can put it on the patient's head like this, with help of this helmet. The length of these ropes is adjustable like this. To connect these electrodes to the amplifier, we can use like these cables with alligator from one side and touch-proof socket from another side. Or you can use electrodes with integrated cable as well. Another type of non-invasive EEG electrodes is like these caps. You also can use this electrode with these helmets like this. You can put it on the patient head in this way. These electrodes are more comfortable for the patients, and actually we usually use these electrodes for prolonged routine EEG examinations or for children, because these electrodes is more comfortable. But anyway, with these kinds of electrodes, we can record only short examinations. If we are talking about long-term monitoring, we should use, for example, like this cap electrodes. We can use the special adhesive paste to put these electrodes on the patient's head, or for example, we can use some plaster, or sometimes it is collodium, for example. But the most convenient way to record long-term EEG monitoring is like these electrode caps or electrode systems with pre-installed EEG electrodes according to 1020 international system. Using this needle and electrode gel, we can put gel inside the electrodes very easy and fast. And today we will work with such electrode systems. One more electrode type is like this needle, single use electrode, which usually used for non-consciousness patients, for example, in intensive care units. This is subdermal EEG needle electrode. Except of EEG electrodes, according to International Federation of Clinical Neurophysiologists Society guidelines, we also need to record one ECG electrode. And a very easy way to record ECG is like this electrode. It's easy to put on the patient's body and easy to connect with this cable. But as for long-term monitoring, this electrodes is not so convenient, and we should use, for example, like this single-use hydrogel electrodes with a special button cables. So now we are ready to switch to our patient. Our patient today is Yakov. We will use an electrode system with pre-installed EEG electrodes. Also, we will use our new generation EEG machine, Neurospectrum 64. This device has 21 EEG channel, separated ECG and EOG channel, and also six bipolar additional channels for different type of signals. Also, I wanted to show you how we connect electrode cap to our device. We use such quite long adapter. Yakov, please, can you stand up and show? Yes, and show. Stop. Yes, please. This is quite long cable because we use special adapter, which also has the special cables for ECG and EOG channels. And with help of this adapter, you can see that our patient can walk around a device in radius about 5 meters. This is made for a more comfortable patient area. Please sit down, Yakov. As for flash stimulation, we will use today this flash stimulator, FS1. It is light, small, and easy to connect directly to headbox, EEG headbox. But also we have an option, this flash stimulator FS2, which is more powerful, more bright, and the brightness also is adjustable. And this stimulator is connected via USB. So now let's try to start our routine examination. In this window, we should put patient data. I'll skip it. And now device is open and we are ready to start. Before we start, we need to check if a device connected to this computer is in good condition. And to do this, we usually use calibration signal recording or calibration signal monitoring, for example. This calibration signal shows us that the amplifiers of all channels which we are using now is in good condition. We can understand it comparing the calibration cat with amplitude of this signal. It is good for all channels. Now we can measure impedance to understand if all electrodes have good impedance. As I told before, we usually use the special tool, needle, to put gel inside the electrodes. Each electrode has the hole where we should put the gel. When we put the gel, impedance become green. It means that impedance is lower than 25 kilo ohm. And when we see that all impedance for all electrodes is quite good, you can press OK button and start monitoring. Monitoring means that we can see the signal, but it is not recorded to the database. We can see quite good signal, EEG and ECG, and after that we can press record button. Please, Yakov, close your eyes, sit still, breathe normally, and try to relax. Now we're recording background test. And during this test, our patient should sit still, breathe normally. Usually, this test is recorded in a dark place, in dark room, without noise, as in our condition now. And usually during this test, we can clearly see alpha rhythm located on occipital derivations. For example, O1, O2. Here we can see some kind of alpha activity. During this recording, user can change the sensitivity of the signal. For example, if it is too high or too low, like in our case, we can change the sensitivity. Also, we can change a sweep speed. For example, like this, we can change the velocity of signal. We can change filters. For example, we can try to switch on our notch filter, and we can see that we have very big notch noise. I will switch off my notebook from the net, and now you can see that noise is smaller, but it is still present on the signal. That's why I need to use a notch filter in this condition. Okay. According to International Federation of Clinical Neurophysiologists Society guidelines, we need to record a background test around 20 minutes. But for now, we will skip this time and we'll switch to another test. The next test is eyes opening. Yakov, please open your eyes. This is the very easy test when patient is opening eyes. And we can see here depression of alpha rhythm on occipital derivations. And now we need to ask patient to close eyes, and we will see alpha rhythm again. Yakov, please close your eyes. And here you can see quite good alpha rhythm activity. The next functional test is provocation, flash stimulation with different frequencies. I'll start it. This flash stimulation probe start flash stimulation according to predefined program. The name is flash stimulation. We can check all commands of this stimulation here in the special window. We can see the progress bar here and here on the button. We can see that first command is already done, then pause 10 seconds. The second command, 2 Hz stimulation, also 10 seconds. Now it's pause going, and so on. In acquisition style, in this software, we can set up any commands, any stimulation programs with different frequencies, with different pause between commands and so on. But according to International Federation of Clinical Neurophysiology Society guidelines, we should record flash stimulation according these frequencies, which are already present here in default settings. I will not continue. I'll just press next test. It is after flash stimulation. We will stop it here. During this test, we also need to check if alpha rhythm is restored. Now we can see it. It's like in background test. And next test is also provocation. It's hyperventilation test. And during this test, we need to ask patient to breathe very deep as possible. Here I wanted to show you that the software can make sound notifications for the patients without doctor, like this.
Please breathe as deep as possible.
This is the possibility when you can pre-record a voice command for the patient and set it for each functional test. And this will help your doctor or nurse or assistant to make the same test day by day without speaking with the patient or without any difficulties. So, Yakov, please breathe deeply. During this test, we need to check if any epileptiform or paroxysmal activity is present on EEG. Now we have a healthy patient, that's why we have no such kind of activity. We have a quite good alpha rhythm here. And the alpha, after hyperventilation test, it's also relaxed like background test where we can check that alpha rhythm is restored after hyperventilation. And we can see it here very clear. Now we can stop the recording and we can review our EEG traces. We can use some measuring tools to analyze it. For example, we can use wave measuring mode to check amplitudes and frequencies and spectral graphs of selected fragments. For example, here we can see that middle frequency is around about 9 or 10 hertz. For example, we can compare it with this episode or with this episode, something like this. And also we have quite a lot of different type of analysis in this software. I'll show you a little bit later. And now we will switch to report preparing. To prepare a report, we need to use this button. We can select report template from this list of predefined report templates, or we can just press this button to use default report template for this type of examination. It is also customizable in acquisition style. You can set up the default report template which you want to use to prepare a report. Here is our automatic generated report with a technical description of all functional tests. For example, for background test, we have a quite big description with all rhythm activity description with amplitude and spectrum and asymmetry and so on. For opening eyes, we have only one description. Alpha rhythm index is decreased by about 70%, and on closed eyes it's decreased by 20% according to background tests. It means it was restored, and so on. Also, you can use this glossary window to put to report some predefined typical phrases, for example, from Luder's classification, or you can put here your own phrases for doctor, which he want to use, some typical phrases which he want to use in the report. Also, you can put to report any results of analysis, or for example, some selected episodes of traces with some interesting activity. For example, we can use context menu just to copy this episode of EEG to the report. When report is ready, you can print it, and that's all. After that, you can save and close the examination. It is done. That is how we perform a routine EEG examination. And now I want briefly to show you an example of how we can analyze epileptiform activity. Here I have the special example with some epileptiform activity. But to find it, I need to review very long EEG traces. It is not very easy way, and it's time expensive. Instead of this, I'll open epileptiform activity analysis window. And here I have the special tools for automatic search, spikes and sharp waves, and any other paroxysmal or epileptiform activity. I press one button, and now program analyze all record and find 3,000 of spikes and 700 of sharp waves. All these episodes are selected with this green bar in navigation line, and I can easily navigate to these episodes like this. Here I can see very clear spike and slow wave episode, and it is automatically marked here. I can move to another one here, and I can see, let's check another one. This is bigger one, and here we can see that seizure activity is started here from this point. We can decrease the scale to see it more clearly. A lot of spikes and slow waves here, and this is the typical seizure activity. On this table, on the first page, we can see number of spikes and sharp waves and average spike amplitude and average sharp waves amplitude for each duration. And we can compare on which duration we have more spikes or more sharp waves here. But more convenient way to do it with help of these maps. On these maps, we also can see number of spikes and average amplitude of spikes and number of sharp waves and amplitude sharp wave average amplitude. For example, using this map, we can clearly see that average spike amplitude is bigger in F4 duration. And we can compare it here. For example, if we will check average spike amplitude, F4, it is 298 microvolts. It is the biggest amplitude of a spike according to all derivations. That's why here we can see the red area, and it is very easy to understand where the paroxysmal activity is located. On list tab, we can see all list of spikes selected by the software. If we press one, we will automatically navigate to it. And also we have a list of all selected fragments, which software select automatically. We can also move between them. We can check them. If we are not agree with them, we can remove, for example, remove them with context menu, or we can change the location or change the duration of this episode also. By the way, here in the bottom part of the table, we can see the number of selected fragments. It is 13 episodes. And we can also see the index of episodes. It means the number of episodes per hour. For this patient, it is 40 episodes per hour. It is very high index. And also we have a time index. Time index means that 60% of all EEG was selected by software as sharp waves or as epileptiform activity. It's also very high percent. Burst suppression table shows us selected burst suppression episodes. For this patient, we have no such episodes. And here is the last and very interesting page with average traces. It means that here we can see average spikes. It looks like evoked potentials window, but instead of stimuli, here we can see the average spikes. We take spikes for all spikes for each duration and just average them. And here we can see the result of this duration. And also here we can see the location of spikes according to its amplitude. It's also located in this lobe area from the right side. This is briefly description of analysis tools. We also have a lot of other analysis. To learn more about it, you can view video on our YouTube channel.